Take this job and shove it. I ain't working here no more. Everybody's working for the weekend. Taking care of business every day. Now it's wow, 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 wow. Welcome to the working week.
Working 9 to 5, what a way to make a living.
Minimum wage.
So we've got a lot going on lately. A lot in the news. Obviously, our hearts heavy with the recent events out in Boston.
Absolutely.
You know, just something you would never think to see. Certainly nothing I ever thought I would see in my lifetime. Someone attacking Boston Marathon, and certainly all the innocent people that are there. So our thoughts and prayers do go out to all the folks recovering and the families affected by the tragedy and the loss there. So good to see it resolved with the investigation and finding that. So, but moving on, we're also dealing locally with a lot going on in the budget world.
Budget cuts, yeah.
As you know, a lot of the programs that are out there. So we're part of the public workforce system. Work with the Central Mass Workforce Investment Board, which oversees for Southern Worcester County, 38 communities in Southern Worcester County, the public workforce system, and connecting job seekers and employers with each other through mainly through our career centers in Worcester, Milford, and Southbridge, but also through a variety of other projects and programs, including youth programming and summer jobs and other projects that are out there. So obviously, we do keep a fairly close eye to, our bottom line, which is the public dollars coming in through the system. And on the federal level, we're dealing with the sequester.
Yep.
That's kicking in and will be majorly affecting operations at the Career Center, especially July through September. That's the first quarter of our fiscal year, which relates to the last quarter of the federal fiscal year. So the sequester cuts are coming locally, will really be impacting operations at the career centers and at our office as well on that first quarter.
And that first quarter is when a lot of the training dollars are allocated to customers?
Correct. Well, a lot of people, yes, a lot of people that are entering training do so kind of in lockstep with the start of the semester in the fall, and so that's going to be negatively impacted by the sequester cuts, as well as there's for folks collecting unemployment benefits that have been out of work or collecting for more than 26 weeks. Mm-hmm. There's going to be a reduction in those benefits. So an across-the-board cut will be impacting those collecting unemployment. So going into effect here, the week ending May 4th, will be a 12.8% cut for anyone collecting unemployment benefits beyond the initial 26 weeks. And the reason for that breakdown is that the first 26 weeks are funded through the state system, mm-hmm. and then the remaining ones are federal. And it's those federal portion that's being affected by the sequester.
Now, is that considered long-term unemployed, or is that just the regular?
That is, but it's part of the definition of long-term unemployed would be someone that's unemployed more than 26 weeks traditionally. Mm-hmm. But that's also just happens to be part of the breakdown between the federal and state funding line there. So certainly that's something. We're also locally, as you know, dealing with our state budget. We do get a bit through that for serving job seekers through the Career Center and help setting up that infrastructure to serve those as well as employers. And then also our summer jobs program and our School to Career Connecting Activities program, mm-hmm. which is a school year-based program helping to connect young people with internships and part-time jobs. And for the small investment that we get locally, about under $100,000, we're able to help broker over $1 million in paid internships and part-time jobs for young people, mainly high school students, high school juniors and seniors, and some sophomores as well.
And here locally, that's with Worcester Public Schools and in the Blackstone Valley area.
Yeah, there's about 12 schools 12 school districts that we work with as part of that program. And we also have affiliations with many of the other schools in the district when it comes to that project. The Summer Jobs Program last year able to serve over 400 youth and give them a work experience during summer, keep them active, keep them learning through the summer.
And developing those skills.
And getting a few dollars in their pocket as well, which as you know, goes back into the economy by and large. You know, they're out there using that money for purchases, so it goes back into the economy very quickly. And so that's a state budget item that's also being cut. So you've got, you know, those three main ones. The Career Center line item that's seeing a reduction. They actually had been proposing increasing it because to help offset some of the federal cuts that we're going to be taking, as well as looking at you know, a little bit more equitable share statewide. A large portion of that fund does go towards the Boston area. It's just kind of a quirk in the distribution of those funds. So looking to help make it more equitable by kind of increasing some of the funds that go outside of the Boston area. So
those three are kind of the priority areas of the board, and what the board's been really backing and following and
correct.
trying to. Okay.
Yeah, correct. You know, so those 3 areas, the one-stop Career Center line item and the Youth Works, Youth Works, and then Connect Activities. And I should say that they have received tremendous support from our local elected officials.
Yep.
So that's great. Last month we had Frank Kartheiser from Worcester Interfaith, who does a great job of really getting the word out through their network about what the issues are, including those programs. So we thank them for their support. So, you know, a lot going on these days with that.
I also just wanted to mention real quick, going back to the Connecting Activities line item, I attended an event with Bob. We went to the State House, and they had some of the representatives who were sponsoring that bill for Connecting Activities, and they had some of the youth who went through the program, and it was just very powerful to hear them speak about their experience and what they got from it. And
well, and the data shows that participants in an internship, part-time job, the participants in Connect Activities actually have a higher rate of staying in school, staying with it, graduating, and then, as we know, young people that have a job and work experience while they're young have a higher rate of employment as they enter their adulthood. So those effects, those positive effects, continue into adulthood. So, you know, for our local economy, it is a big deal if we're not having young people gaining those work experience. Speaking of unemployment benefits, we also do have an interview that you had done.
Yeah, I had a chance to go attend there's a group that meets, they meet once a week on Tuesdays, and you'll hear more about that with the interview. I met with Christopher Horton, who's the volunteer organizer at the Worcester Unemployment Action Group. So they're doing a lot of exciting things around policy for the unemployed and developing jobs.
So it's really kind of the grassroots. It sounds like it's almost a combination. And I've attended a meeting or two myself to help talk about the public system. So it's almost like a bit of a support group as well as an grassroots advocacy group. And really trying to help change the message that's out there about the need. So why don't we roll that interview if we could?
Let's roll it. Hi, I'm here with Christopher Horton, the volunteer organizer for the Worcester Unemployment Action Group. Chris, how you doing today?
Very good, thank you, and
Thanks for joining us.
thanks for having me.
So the Worcester Unemployment Action Group, can you tell us a little bit about that? How long it's been in existence? What you guys have formed it for?
Well, we're an all-volunteer group. We've been meeting just a little over a year. We've been meeting at least once a week and calling various forums and actions, and we're mostly made up of unemployed people of all ages and education groups, and men, women, young, old, black, white, English-speaking, Spanish-speaking.
Oh, everybody's invited. Open.
Everybody's invited.
Great.
And we're trying to change public policy, change the public conversation, and change the laws around job creation and support for the unemployed, and we're also pushing for a more truthful and realistic discussion of the problem, because it's a much bigger problem than you would guess from the official statistics.
Yeah, can you tell us a little bit more about that? I know we've talked about it on our show, how the U3 data, which is the unemployment data used by most of the media and generally accepted as the unemployment data, it doesn't take into account certain groups, some of the long-term unemployed, some of the discouraged workers. I know there's some other groups maybe you can point out.
The U3 rate is not actually an unemployment statistic at all. It's a measure of a very limited, carefully defined group of people that are recognized by the Bureau of Labor Statistics as job seekers. And it leaves out so many categories. If you've never held a job, kid just graduating from school is not counted as unemployed until they've held a job. If you're taking even one course, and lots of people, when they lose a job, they go and sign up for a course to work on their skills while they're looking. They're not counted as unemployed then. If you're working part-time, you're not counted as unemployed. Even if you're not getting paid for it. Somebody doing an hour's work on the family farm is not counted as unemployed.
Right.
And then there are the long-term, then there are discouraged job seekers. The government's U6 rate includes people that have looked for work in the last year, but there's a large and growing number of people who've just given up. It costs too much money and is too discouraged, but if they had hope for finding a job, they'd be back.
Right.
And right now, the government isn't even asking the question. We can only guess how large that group is, but it's quite large.
So there's a number of groups that aren't included in the U3 unemployment rate. So just to give folks at home an idea of the difference between these, can you give us an idea of what the difference is between U3 unemployment rate and then a perceived unemployment rate based with all of these other groups included?
In Massachusetts right now, the official U3 rate just dropped to 6.5%, I believe it is. It dropped 1/10 of a point. The U6 rate is up around 13%. And if you include long-term discouraged workers, that category has been moving upward, and nationally it's at a little bit under 23%.
So it's a substantial difference.
But that's really a guess. That's based on looking at how many people have dropped out of the labor force and attempting to reconstruct what it would be. But it's a huge difference. And if you take that 23% figure seriously, and we do, we're talking about depression-level unemployment rate.
Mm-hmm. And so the other side of this, the policy change that the Worcester Unemployment Action Group is working on is job development.
Yes, and what we're seeing is that efforts to induce or bribe corporations to create jobs are not working at the federal level. They're not working for states or for cities. What has to happen is direct federal and state job creation. We have simply got to go after the money where it is and put it to work, putting people to work, doing all of the different things that need doing. Mm-hmm. We're in a country which is living on the borrowed infrastructure work of previous generations, and the amount of delayed and unmet needs just to bring our infrastructure back to a healthy condition. It would put tens of millions of people back to work. And the money's out there. Mm-hmm. The corporations are sitting on huge piles of cash. The wealthy have trillions of dollars sitting in offshore bank accounts. the amount of money that would, well, we're supporting a bill now, the Humphrey Hawkins 21st Century Full Employment Act. One of its most active co-sponsors is our own Congressman Jim McGovern. And that would raise $2.4 trillion over the next 6 years, with a small tax on each stock, bond, or derivatives transaction.
Right.
And would put millions of adults back to work on public projects, and millions of young people to work on job training programs. And finding money would not be hard if we had the power.
So it's the support. The group needs more support, needs other people to get involved.
Yes, and that's why the unemployed need to get involved. There are millions of us.
Right.
40, 50 million of us. And if we start to get involved in large numbers, demanding change and demanding relief and demanding jobs and recognition for our real situation, the
ask
government will
heard.
have to respond.
Yep.
But if we remain silent, quiet, waiting for somebody to do something,
Right.
we're not part of the conversation right now, and that's what has to change.
So you got to be the squeaky wheel.
We've got to make one heck of a squeak.
So, getting back to that, if people are listening at home and they think this is a great thing and they want to get involved, I know you said you guys meet weekly, so you guys meet on Tuesday afternoons?
Yes.
And where do you meet?
We meet Tuesday afternoons 1:30 at St. John's Church in Worcester on Temple Street. And
they're open meetings, everybody's involved, unemployed, employed, anybody who's just
anyone who's
looking to help.
concerned about this issue and is interested in possibly doing something is welcome. And also people that are struggling with the system, trying to get unemployment assistance. We're not professionals, but we'll give you the benefit of our experience and hook you up with people that can help.
Great. And so your phone number, if people want to contact you, your email.
You can call 508-614-WUAG. That's 614-9824. Or email at worcesterunemployed@gmail.com. All one word, worcesterunemployed@gmail.com.
Great. Chris, I thank you for taking some time to talk with us. Is there anything else you wanted to voice over to our listeners? Any words of advice?
Well, just don't blame yourselves for the situation you're in if you're unemployed. Don't hang on to your shame. A lot of people feel like they caused their own problem, but this is much bigger than any one person, and it's not your fault that the economy collapsed. It's not your fault that it isn't recovering, and you need to get together with other people that are in the same boat and start working together to change this situation. It's tremendously good for depression.
Great. Thank you, Christopher. So again, we just talked to Christopher Horton, the volunteer organizer at Worcester Unemployment Action Group. Thanks again, Christopher.
Thank you so much for having me.
All right.
Okay, thanks, Sean. That was interesting. Chris, God bless him and the work that those folks are doing. Trying to organize a grassroots effort is not easy.
No.
I know he puts a lot of time and effort into it. So.
Yeah, and check out a meeting if you have a chance. It's
Yeah. So it's every week.
Yeah,
they do
weekly.
it over
They do it
at
weekly, yep.
St. John's Church. I think it's in
Temple
the
Street,
basement there on Temple
44th
Street.
Temple Street. Yep.
Sure. So, and certainly the issues that they raise about unemployment and the and what's happening there are important.
Yeah,
Not everyone would agree necessarily with their view on what needs to happen, but certainly a lot to chew on there. And unfortunately, I don't think the issues that they're raising or attempting to raise just get enough discussion or enough debate. Even if you don't agree with them, I think we ought to have a more healthy and lengthy discussion of these issues than just kind of brushing past them. In some ways they're a hidden constituency. The unemployed right now. So thank you for taking the time to do that as well. And so one of the issues that they're working with is the fact that you've got more and more long-term unemployed. So people that are employed more than 26, unemployed more than 26 weeks. And there a great report and a great story in the Atlantic magazine. I'd advise folks to go and check this out. It's called The Terrifying Reality of Long-Term Unemployment. And basically, it's a report about a study that came out by some economists that talked about how there's really two labor markets out there right now. If you're looking at unemployment and what's happening with reemployment, people that are unemployed more than 6 months, so people that are unemployed about 24 weeks or longer, have a tremendously more difficult time getting a job.
Well, you can imagine that, right? That gap in work history. I mean,
so you've got a lot going on there. A lot of I think there's a lot of just psychological things happening with an employer when they see that gap. I don't even think intentionally or consciously necessarily even think about, oh, well, this person must be lazy or this person mustn't be, their skills must be up to date. Certainly there probably are some that do think in those terms, but I think, it might just be in some cases more unconscious. But when you think about, and we had a great discussion at our last CMWIB, our Workforce Investment Board quarterly meeting with a presenter from the group that compiles these figures. That's the Bureau of Labor Statistics. More than a third of all people that are classified as unemployed have been unemployed longer than 26 weeks. The average duration of unemployment, is over 30 weeks. So think about that.
Right. So there's a
and
lot.
And think about the fact that the employment rate. Here's an interesting from the Atlantic study, which is article, which is based on that study. People with less work experience and relevant work experience to a job get called back for an interview at a higher rate than someone with relevant work experience in history who's been unemployed more than 6 months. So
that's like a huge that gap.
Yeah,
just that
think
long-term
about that. That's
unemployed.
counterintuitive, right? I mean, so they're saying that's like the biggest factor right now. And so, when you talk about the issue of unemployment, that's what you just saw. I know one of the things that we at the board have been working with folks at Workforce Central at is how do we address this problem?
I was just going to say, if you're a job seeker, facing this, what would you do?
There's obviously no easy answer. You got to keep plugging away. You got to keep putting the resumes out there. Keep networking. That's another big one, is keeping a set networking schedule. But one of the things that we've come up with that we think, it's not going to eliminate the problem by any means, but certainly can help meet some of that relevant recent history kind of employment gap, is to get people working as volunteering with local nonprofit organizations.
So kind of like an adult internship?
Yeah, exactly. Now, technically speaking, it's not. There's a big difference between an internship and a volunteership. Internship is tied to a training program, an educational program.
Right, you get credit of some sort.
You get credit. It's part of the training, and it would allow you to actually do that volunteer internship at a for-profit company. Whereas volunteership can happen with any nonprofit, municipal, as well, nonprofit groups. So, we're working to connect people. We're working with United Way and many organizations in the area to help connect them with job seekers that are looking to volunteer while they're unemployed. And it's a great opportunity for them to go in, to work with, it might be for a cause that they believe in. It might be for a group that they've worked with in the past that they like. or what what have you, but they're able to really kind of develop their skills, maybe a new skill, maybe practice older skills, stay up to date. The thinking behind it is that they're going to be going there and actually working on some really solid projects that will give them something they can point to an employer to show the employer that they still have value to them, that they still have something to offer.
Right.
And then
it shows that initiative too, that they're willing to go out there and volunteer.
Yeah, and think about all the other good things that are going to flow from the fact that they're regularly involved now with an organization and
you
in
mentioned
the workplace environment, networking, and all that.
Yeah, I was going to say, you mentioned networking, and I mean, you're basically selling yourself there. I mean, you get an opportunity to work on a project and really sell your
and probably
skills.
interact with many partners that organization has to really kind of get the word out about what you're doing and what your skills are. So we're encouraging that. We've got a new program called Volunteer Connections.
Yeah, I was going to say, so if I was a web designer and I had been out of work for a while and I was looking to get involved with a volunteership like this, what would be the process like?
Well, certainly you'd want to go connect with the Career Center, and if you actually look online within their additional program resources page, there's a section on Volunteer Connections. You can go to that. Watch a video. They got a pretty famous announcer to do a video about it, to narrate
James Earl
that.
Jones or
No, not James. It was actually me.
more popular?
No, I was talking about me.
Oh.
The edgy guy with the goatee. Yeah. So you watch the video. It explains.
Kind of walks you through the steps.
Walks through the steps, and then from there you would meet with a staff person, and they would actually kind of help you pinpoint where some fits might be for you with organizations that have that need. So like you said, that'd be a great opportunity for a web designer to work to help revamp or to create a website for a nonprofit organization that's out there. So again, meeting that gap or closing that gap in a resume and showing relevant recent experience and value to a potential employer.
Yeah, this seems to be helping on twofold. I mean, you're helping the job seeker, and you're also helping some of these nonprofit organizations with limited staff time that maybe have some projects.
Which in turn are helping your community, right? So
yeah,
it's like
volunteer connections.
It's a win-win, as we call it in the business. So we're excited about that program, and I know, speaking of the community and things going on in the community, we had a chance. We have kind of a multi-part interview with Derek Brindisi.
Yep.
Department of Health here in Worcester, who's going to talk to us about some of the initiatives that they've got going on. They've got a lot of interesting things happening there. So, Dr. Zukowski, are we ready with that to roll that interview?
Yes. First, I want to do this. This is WCUW 91.3 FM Community Radio serving Central Massachusetts and online at WCUW.
Hearing that voice, you should have
Smooth.
narrated. He should have narrated the
The fourth Wednesday of the month is the Working Lunch with Jeff Turgeon and Sean McGauley.
Hi, we're here with Derek Brindisi, the Director of Public Health for the City of Worcester. Welcome to the show. Thanks for being on the Working Lunch.
Sure, thanks for having us.
So why don't you tell us a little bit about your department and your role with the city?
Yeah, great. So I'm the Director of Public Health for the City of Worcester. The Department of Public Health, I think, is one of those departments that the public doesn't typically recognize the work that they do, because a lot of the things that we focus on is really prevention-oriented. So we have staff that focus on a lot of different preventive type of activities. So we have individuals, public health nurses that work out in the community and try to focus on communicable disease, breaking the transmission of certain types of infectious diseases. We have staff that focus on public health emergency preparedness, and those individuals, they work in the community, they work with the hospitals and the health centers and the EMS providers, and they build capacity to respond to large-scale events such as snowstorms. The staff that focus on substance abuse, so we have two individuals actually, their work revolves around preventing tobacco use, trying to focus their energy on preventing individuals from overdosing as it relates to opiate overdoses, trying to prevent the use of underage drinking. And then a new grant we just received has a special focus on trying to prevent youth access to prescription drugs. We recognize over the course of our research the last couple of years that more youth are using prescription drugs than ever before.
So painkillers and
yeah, Percocets, Vicodins, those types of drugs. individuals, youth in particular, are using those for recreational purposes. So that leads to other types of problems such as heroin use and such.
And the thinking, of course, is that a small investment of public resources can have a huge dividend when it comes to, you know, the prevention piece and preventing the costs later down the line. I mean, if someone is, the cost to the system, never mind the human cost, but the cost to the system, if there's a flu virus or so, you know, is huge, and or a drug overdose or whatever, the cost of after the fact becomes a lot more expensive than trying to prevent in the first place.
Yeah, absolutely. And so they would, some of the researchers would suggest that every dollar spent in prevention would save $5 in the short term in healthcare costs. In the long term, could save up to $10 in healthcare costs. So certainly, especially the Affordable Care Act today, there's been a large emphasis on doing prevention work and really focusing upstream and trying to identify some of the problem areas. So a lot of the work we do really focus on some of the social factors. So we try to engage other municipal departments like housing and public works and public safety and planning, because a lot of the things that they're doing has a direct impact on the work that we're doing and trying to prevent various types of illnesses and diseases,
Sure.
you know, downstream.
And I imagine too, I mean, there is a connection between workforce development and the economy and health and how that relates. I mean, they interact in a lot of different ways. Certainly, if population is gainfully employed, I think it probably tends to lessen some of the challenges from a health perspective. More people have health insurance, for instance.
Yeah, I mean, that's probably the more logical example that, you know, if people are employed, especially in the Commonwealth, where up to 95 to 98% of the population has some type of health insurance, you would assume that if you're employed, you have coverage, you have access to a primary care physician, and therefore you should have better health outcomes. But then there's also the opposite of that spectrum, is that when an individual is unemployed, what are all the other things, you know, beyond not having health insurance, do they occurs? And so some of those would be like depression, starting to abuse various types of drugs and alcohol, you know, all those, you know, other co-occurring issues.
At the Career Center, sometimes we see, and with the youth programs that we fund too, I mean, we see, you know, people get on that downward spiral, right? They have a hard time finding a job, they get more depressed, they might abuse drugs
right.
more, you know, and just kind of that vicious cycle of depression, and so, you know, sometimes, a lot of times, it's that job, though, might be a critical component to breaking that cycle, and especially if you can do it early on, and you know, speaking about prevention. So we're here with Derek Brindisi, the Director of Public Health, City of Worcester. And Derek, I know you have a lot of interesting and important projects going on. Do you want to talk about some of the things that you got going on?
Yeah, sure. So our department, again, we're a very small department, but we're very lean and efficient in what we do. And one new aspect of our work is that we're not just a city department any longer. We're actually a regional health department. We were fortunate enough to receive a $325,000 grant from the State Department of Public Health to regionalize municipal public health services, which again, you know, with the Patrick Murray administration, they've been really pushing regionalization of municipal services. So we're fortunate to be a part of that. And so we're focusing a lot of our energy now in the towns of Millbury, Shrewsbury, Holden, Leicester, and West Boylston. So we're working with those boards of health, we're listening to the needs of those communities and those residents, and trying to adjust our services to meet those needs and those demands within each one of those communities.
And does that help to leverage the public funding that goes into these programs? You've got, instead of having small individual communities, you know, trying to do it all on their own, is there like an economy of scale that develops with that?
Yeah, I mean, that's the whole notion, that there is an economy of scale, especially some of the smaller communities. They don't really have an infrastructure. They have limited dollars, and typically those limited dollars, when a municipal budget, they go oftentimes to education, public safety, and public health kind of gets, you know, put aside. So they focus more of their energy on meeting the state mandated services. And so by brokering these agreements and working with these towns, they pay into the system. So they use the limited dollars that they have, and they contribute those dollars to the city. And then we're able then to expand our services. So for very similar dollars that they've always paid for in the past for public health, they've actually almost doubled the types of services that they would not ordinarily have had in the past.
Sure, and I imagine too, from just a pure health perspective, I mean, people are very mobile. They often work in Worcester or commute from Millbury or vice versa from the communities outside. So, unfortunately, a disease, a disaster, those things don't, stop at the city border, right? So,
Yeah, absolutely. I mean, and we've always, Dr. Morse, the former Commissioner of Public Health, would always say that a disease has no boundaries. So, we dealt with pandemic H1N1 in 2009, 2010 flu season, and they didn't stop here. So the work that we were doing in the city of Worcester would translate into those communities as well. So we're excited about that work because certainly it helps us and it helps the communities, and it actually raises the level of type of service that all residents should be receiving as it relates to local public health.
well, and that's
with
it's great to
Derek.
hear
Is he
from Derek and
there
all
he is
that
again.
stuff going on. Yeah. So, so we're happy that he was able to come on and talk about that
Yeah.
and all that they've got going on. And Sean, I know, speaking of of things, you've got
Yes, I've got some
you've
things
got
here.
some things as well.
So
it's mail time.
Mail time. So as you know, we get tons of emails from our listeners and our viewers. Lots of times, different questions about the Career Center and the work we do. Again,
Including
our
some. I know you're recently
fan
married.
fan mail.
And I think Sarah's the name of your wife. And I think she's been a little jealous of some of the romantically tinged
Yeah, she's having-
emails you've been getting lately.
She's having a lot of trouble with the stardom of the show.
It's trouble.
When you go out to
It's a
eat,
hard
people
time.
want autographs, and it's just.
It's the price of fame, my friend. All right, so why don't you share with us some today's mailbag question?
So today we've got an email from Stan in Milford, and Stan writes, "Hey guys, I was wondering if there is internet access to the Career Center." So I know the answer to this one. There is, but I wanted to go one step above for Stan and talk to the staff at the Career
Which is
Center.
what you do,
That's just my
A
style.
lot of guys would you could have just given like a
Yeah,
one-word
yeah,
answer.
Stan.
Yes.
Yeah, Stan.
Yes, Stan, we do.
Next
but
email.
you go above and beyond. You're gonna give him probably more information than that.
I've got more information. So I talked to Wendy Gould, who's the I'm not sure of her exact title, but she's one of the staff there at the Career Center. and
Resource
she-
room coordinator.
Coordinator.
I think. Yeah.
Yeah, I wasn't sure if it was
She does a great
coordinator,
job
but
there. Yeah.
Awesome job. And so she put a list together of all the stuff that.
She's also involved. We mentioned earlier the Volunteer Connections program. She's the point person for that program that people meet with.
She does it all.
She does it all.
And a great job. So they do have internet access. They've got 10 computers there where you can conduct your job search activity, apply for different things.
Yeah.
You can also use their resume templates that they have. They have a design where you can work there. You can also print it on like the nice thick cardstock, the resume paper. You can print that there. You can fax out resumes and you can fax out your cover letters. And they'll actually stamp and mail 3 job search
Wow.
things for you.
So yeah, I
and
know a lot of
you're
a lot
probably
of it is
wondering-
done electronically these days. But if you're still,
you can
and
send
there-
the
but
hard
there
copy.
are a lot of smaller
Yeah, I've seen-
companies that are requesting.
Yeah, some
That, yeah.
you still do need to mail out, and you're probably wondering, how much do all these cost? Like, how much do I have to cost to get into the resource room? Any idea?
Oh,
Like a lot.
per visit. Are we talking like a monthly pass?
You tell me.
$20.
It's free, Jeff.
What?
It's free. All those services are free.
But you could pay $20 if you want to.
Yeah, make the checkout to Sean McGauley and send it.
That's what I think people need to understand, though. In all seriousness,
Right.
that these services are out there, and you can come in, take advantage of it. You can also do a variety of workshops. I know we've talked in the past with folks there about the different workshops that they got going on, including workshops on some of the new social media.
Yeah.
That's happening. I know we met with some folks that are just launching. It's a local company just launching a new online service to help people find job listings through Twitter. And so it's a website called Gozaic.
You don't want to give too much away because we're probably gonna
Have them on at some
Segment,
point.
yeah.
Yeah. Well,
give them the teaser.
so it's a service that helps people search Twitter announcements, tweets, and so helps them search that for job company tweets about open job vacancies that they have. So, and it's kind of a bit on the edge, bit new.
Yeah.
And so there are some listings on there that you might not get through a normal kind of job board, which they all have which we have access to at the resource room and can advise people about. So.
Yeah. Well,
So Stan,
more
if
to
you're
come
out
on
there,
that. More to come on that. Right?
you get 110% from Sean just now about in reply to your query.
Yeah, and other questions, please email them. The email is workinglunch@wcuw.org, and we'll do our best to answer them all.
Well, speaking of doing our best, we speaking of
Love
things,
these seamless segues.
seamless. Speaking of things, one of the things that we do want to try to do and have been increasing, talk about that lag in long-term unemployment. Another thing that we've been doing too is really getting people information about starting your own business, how to access information about starting your own business, how to develop a career plan, a business plan, access capital to start your business, and other things. So, one thing that we do want to do is help focus on putting a spotlight on some small businesses that are starting and businesses that are out there. So I had a chance to talk with Dawn over at Natural Pathways, a local reflexology. Yeah. So we're going to go. Dr. Zukowski, are we ready with that? Hi, we're here with Dawn Skolund from Natural Pathways. You're the owner of Natural Pathways and founder, so welcome to the Working Lunch.
Well, thank you. Thanks for having me.
And Natural Pathways, tell us a little bit about your company.
Well, my mother and I are in business together, and we're both board certified reflexologists.
So tell us a little bit about reflexology and what that's all about.
Well, reflexology is a non-invasive complementary therapy that works through basically your feet. It can be other areas as well, like your hands, your face, and your ears. There are reflex points on your feet that when applied a thumb or finger walking technique that's specific to just reflexology, it helps your body reduce stress, relieve tension.
So, but it doesn't involve needles or
needles.
Fire or anything like that?
Nothing scary like that.
How often do people use it, and what are some of the benefits?
Well, some of the benefits are it improves circulation, it helps your body release toxins, and also one of the greatest benefits is it helps reduce stress and tension. So as a society, we're having a big problem with stress. Between 75 and 90% of all doctor's visits are for a stress-related symptom. So by finding a natural, safe way to help your body calm down that nervous system, that fight or flight response that we all have.
Just to the
helps your
day-to-day
body. Just the
rigmarole,
day-to-day.
right?
Because what most people don't understand is they know what the stress response is, they've heard that fight or flight, but what they don't understand is that your body doesn't differentiate between an emergency. Let's say you're
a real life-threatening actual
pick up a car to save a kid versus the ongoing daily stress. So your body
using
does
the right
same
cover
thing.
sheet on your TPC report. So the difference,
So after a while, this chronic stress that most of us are under starts to chip away at your body and have really damaging effects. So one of the greatest things about reflexology is it works right with your nervous system to calm down that system.
So on a personal level, I mean, there are some major studies that indicate, all that stress, really builds up, and like you said, chips away your body, and that's leading to a lot of, basically premature aging, premature death, a lot of all those,
Yep.
And then on more relating it to the business side, you talk about worker productivity, worker absentee rates, and all the, the millions it must cost, companies in terms of that lost, that downtime that accumulates from that. So having people, workers go through with getting things like this must be a big help to keep people, in work and healthy.
Absolutely, and there's a lot of countries around the globe that having a reflexologist on staff is just a part of everyday living. And there's been a lot of studies that show the benefit of having a reflexologist come into the workplace, improve productivity, decrease absenteeism, improve employee wellness, job satisfaction.
What an interesting benefit that would be too, to promote to staff as you're recruiting them or hiring them.
Yeah, absolutely. And currently I'm working with a major employer, and I've been there since 2011, and I go several times a month.
I was going to ask, how often should your clients, does it range on what their needs are,
basically? It all
basically?
depends on what they want. It's up to the client. So some people will come weekly just because it's their self-care time. It's time to just, decompress from the stresses of life. and most people come at least monthly just for like a little tune-up.
Now, is it also good for people that have a specific ailment or injury, like say someone's rehabilitating a bad knee, or if someone has like chronic conditions, maybe migraines? I mean, is it commonly used to help manage some of those conditions?
Yes, it can, although we don't treat specific diseases or because we're not doctors. But just relaxing that body helps everything else. So when you talk about migraines, why does someone have the migraines? That's what I'm interested in. Is it because, if they're female, is it female related? So that would give me a clue for how else I could help.
I'm not going to step in at this point and joke about, husbands having stress, and that's female related either. I wouldn't think to do that. So
the same thing like headaches. People could have headaches because of allergies, or they could have headaches because of stress, or they slept wrong, or they have neck pain, or so it's kind of taking the client's health history that they fill out for us, and then asking some questions.
Now, how did you get involved with it? How did the business come about? Obviously, starting your own business is not for everyone. What were some of the challenges that you faced as a small business owner and founder?
Well, one of the biggest challenges is, I'm specializing in a field that most people have no idea about. So a lot of my time is spent educating the public and participating in community events or health fairs. Next month we'll be at UMass Medical, the Alternative and Complementary Expo at the medical school. So just getting out into the public and educating everybody on what it is. So I think that's the biggest thing is, it's not like it's something well known.
Are there a lot of practitioners in the Central Mass area?
There's not a lot of board certified practitioners.
Oh, okay.
There's a lot of people who have learned a little bit of reflexology in conjunction with something else.
Oh, okay.
But not someone who's
don't
had
specialize.
hundreds and hundreds of hours of training in it.
And I would imagine too, obviously the board certification process is rigorous and really pinpoints as opposed to someone that knows a little bit about it. And so I can understand why, looking for that as when folks are looking for a reflexologist to visit, to look for board certification might be a credential to seek.
Yes, absolutely, because as a professional, there are certain standards and code of conduct and ethics to adhere to, as well as ongoing training. So you're never stale, as you may say, always refreshing your skills and learning more. So it's important.
Great.
So, yeah.
It's it seems like a fascinating combination though, of theory between, the Western medicine side and kind of the Eastern philosophies and theories around energy, and is it somewhat of a cross between the two disciplines or philosophies?
Yes, it is. The Eastern philosophies of health and wellness all goes back to like meridians and how that system works through your body, and so acupressure was it's kind of like another layer onto that.
Okay.
So in reflexology, just takes it another step further. And instead of just having zones or meridians, it's actually reflex points, is that we call them. In Asia, people get reflexology every day. The doctor will actually write a prescription for someone to get it every day for 21 days. Yeah. So
wouldn't that be amazing, though, if our health system were set up that probably very cost-effective preventative measures like this could be added to the mix? Even just, whether it's reflexology or some of the other like acupressure, massage therapy, and things that could be preventative to deal with the stress, like you said, of everyday life. Think of the money we would probably save overall in terms of the chronic, the manifestations that, that happen as a buildup of stress.
The National Foundation of Women Legislators is really pushing for reflexology to become included as, part of the health care for women's issues or anyone's issues,
kind
and
of
just
the
health maintenance.
The range of traditional disciplines that are kind of added into the range of general coverage, is that
yes. Yeah, just to have it more well known and more accepted, and it can be used as preventative as well as when people have an issue, it can help with that.
Now, how can folks get in touch with you and find out more about reflexology and about the services at Natural Pathways?
Well, they can certainly give me a call or email. They can reach me by phone at 508-864-0954, as well as email at info@naturalpathways-reflexology.com.
Excellent. Well, thank you for being on the Working Lunch
Well, thank
and
you.
for telling us about your business and about the services that you provide.
All right, thanks so much for this opportunity.
Great. Well, what do you think, Sean? Huh?
That sounds nice. That
I'll
sounds
tell you,
really nice.
She showed me how it works, and
Do you have the music going and everything?
yeah, I'll tell you, it really does help to kind of revive your spirits and really kind of.
Did it tickle? Wait.
No.
No?
I would. No, it was pleasure. You know, it wasn't like didn't like hurt your feet at all, but it wasn't like a tickling.
So did she tell you how
She
to
wasn't
get
like tickling my feet.
different kinds of inner soul inserts or anything to like help your feet, or
You know, she. You know,
like what's the follow up?
I'm
to
sure.
that?
I'm sure there could be for people, like depending on how you walk and whether you pronate or hyper. I don't even know what I'm.
These terms.
Do I know? Yeah. Do I
these
know
foot
these terms?
I don't know.
So at any rate, it was a but it is something that I'd advise people for as a stress reduction kind of technique. It could be a big help and really kind of help overall, kind of give you a new spring in your step.
Oh, I like that.
Yeah. So, well, we've got a few minutes to go in the show.
Yeah, there's no guest today in studio, but I still wanted to kind of do the celebrity first job game that we normally do. Maybe you guys can take a guess at this one.
All right.
You guys watch the show Mad Men? You ever seen that show?
Oh, Madden! I love John Madden. Like Madden football, and he turducken. I got a turducken here.
Mad Men. Have you ever seen that show? Well, the star John Hamm.
I know. I'm just for, of course, Mad Men, AMC.
Yeah. So can we guess his first job? And I'll little side note. It's a little racy.
Ooh.
For daytime
Racy.
television radio.
He
Wow.
drove cars.
Wow, Dr. Zukowski, one for you. Yeah. Well, I'm gonna guess he was an escort.
He was not an escort.
He was a.
His first job was a set designer for adult films.
Wow.
Yeah. So he said, there's a quote from John. He said, essentially, I had to move furniture around sweaty, naked people. It wasn't a great job, but the money was useful.
Well, but there you go. There you go.
Interesting first job.
Family business, apparently. That changes the dynamic there. All right, so you stumped us on that one. Any others?
Yeah, actually, staying on the racy theme.
More.
Whoopi Goldberg. Does anybody have any idea? You guys know Whoopi. Any idea?
I do. Whoopi Goldberg.
And it's also racy.
Huh. She was
She's on The View now.
escort. I'll go with that again.
She was actually a phone sex operator.
Gross.
Whoopi Goldberg.
Wow.
Yeah, so.
Do we have any, Dr. Tusky, do we have any audio of Whoopi Goldberg?
No, we don't.
Well, thanks everybody. It was another great show. We'll see you next week.
Yeah, we're winding up. We did want to thank Bob Zukowski here, Dr. Zukowski, our
Always does a great
producer.
job.
Thank Jessica and the team at Cable Services for all the work they're doing helping us
Thanks, guys.
simulcast this, as well as our guest today, Chris Horton from Worcester Unemployment Action Group. We had Don Skolund from Natural Pathways and Derek Brindisi from the Department of Health. So thank you all, and we'll see you next month.
Take this job and shove it. I ain't working here no more.